abdominal pain, cramping, bloating, sores in your mouth, night sweats, anxiety, joint pain? What are the symptoms for the two types of inflammatory bowel disease conditions, Crohn's and ulcerative colitis? In fact, all of those symptoms I just mentioned do appear somewhere on this list. So in this video, we're going to be getting to the bottom of what symptoms exactly does Crohn's disease have, which does ulcerative colitis have, and which do they share? Now, my name is Dr. Sean Golden, and I run goldenhealthmethod.com, which is a website dedicated to giving you natural, research-based options for chronic health conditions. And again, in this video, we're going to be getting to the bottom of what are the symptoms specifically for Crohn's disease, ulcerative colitis, and which do they share. By knowing this, you're going to be better able to determine potentially which of these you or a loved one might have or be suffering with. And it might also allow you to recognize the full spectrum of the condition. So let's go ahead and get started. Now first, let's talk about which symptoms both of these share. So both Crohn's and ulcerative colitis will have either diarrhea or urgency, which means that you'll feel like you have to keep needing to use the bathroom, even if you really don't have to, but you'll feel like you do have to, and that's urgency. Now, you can also have constipation. Sometimes it fluctuates between bouts of diarrhea and sometimes bouts of constipation. Again, sometimes that constipation could just be a feeling of urgency where you don't actually have to go, but because of the inflammation in the colon, it feels like you have to go. Now, outside of that, we're going to have abdominal pain. That's an extremely common symptom. We're probably going to have cramping, potentially some blood in the stool. We're going to talk more about that as we go along. We probably will have some weight loss. Now, as the condition gets more severe, weight loss becomes more likely. The weight loss is a couple things. One, there's sometimes a reduced appetite with Crohn's and ulcerative colitis, where you just don't feel like eating as much as you used to, and that in and of itself can make you lose weight. Now, outside of that, because of all the inflammation that's occurring in the colon, we have a hard time absorbing nutrients and absorbing calories and macronutrients, and so just the lack of absorption can also lead to weight loss because it just kind of comes right through us. Now, to give you a quick tip, the most common macronutrient that those with inflammatory bowel disease, such as Crohn's and ulcerative colitis, have a hard time absorbing are actually fats. And there's a reason for this. Proteins and carbs get absorbed in the small intestine. They don't get absorbed in the colon. However, fats need to mix with bile that's secreted from the gallbladder. And then that bile and the fats have to mix together, and they have to go all the way down to the colon before they get absorbed. So if you have chronic colon inflammation, you're going to have a hard time absorbing fats. What that looks like in real life is that when you eat a lot of fats at once, if you have a fatty meal, whether it's fast food, restaurants, maybe just a lot of oil that you cooked with, any of those type of things, if you don't absorb it, not only are you going to be more likely to have diarrhea-like symptoms, but it also can lead to more inflammation. You might feel worse for the rest of that day or the day after with meals high in fat, for example. Now, you can also sometimes get fever, and sometimes you can be fatigued. And in fact, fatigue is actually a very common symptom when it comes to Crohn's and ulcerative colitis. More often than not, people with IBD, inflammatory bowel disease, do suffer with some sort of chronic fatigue, even if it's at a low level. Now, sometimes if you've been dealing with this for years and years, you might not even recognize that you have fatigue. It might just be your new normal, and you might not recognize how normal should feel or how much better you could feel if you got rid of the fatigue. Now, there is a powerful research-based option for you if you're suffering with fatigue and you have Crohn's or ulcerative colitis. And I made a whole video on that actually, and I'm going to link it in the description below, so make sure you go to that video and check that out. and watch that if you are suffering from fatigue with inflammatory bowel disease. Now, outside of that, we also can get night sweats at times. The night sweats can be partly biological from the inflammation and from the overactive immune system, as well as from anxiety, because this type of condition is really likely to influence you mentally, and just because you're suffering all the time, you don't know what the future holds. And that in and of itself, not knowing how you're going to be in a week, in a month, in a year, in 10 years, if you're going to need surgery, all of that stuff can be very anxiety provoking, and that can also lead to night sweats or waking up in the middle of the night kind of drenched a little bit. And the last thing is joint pain. Now, both of these conditions can actually lead to joint pain, and this is sort of a side effect from the fact that you have chronic inflammation occurring throughout the body. This chronic inflammation for ulcerative colitis is more likely to be just in the colon. However, we can sometimes experience joint pain even with ulcerative colitis because of just full body inflammation trying to help what's going on in the colon. Now, for Crohn's disease, because it's more extensive and it can go anywhere from the colon all the way to the mouth, it's more of a full body condition, and joint pain is actually even more likely in Crohn's disease. So those are the common symptoms. You don't have to have all of these symptoms. These are just potential symptoms and the most common symptoms for these conditions. Now, let's move over to Crohn's disease. For Crohn's disease, kind of like what I was already alluding to, inflammation can appear anywhere in the GI tract for Crohn's disease, which is not the same for ulcerative colitis. For Crohn's disease, it's a full gastrointestinal condition, which I was talking about in my last video, where I talked about the similarities and differences between the two conditions. In that video, I go over different information than in this video, so make sure you check out that video if you haven't seen it. I'll also link it in the description below. But again, anywhere in the GI tract, which means it can go all the way up to the mouth. So it can be colon, it could be stomach, it could be esophagus, it could be throat, mouth, lips, gums, that type of thing. So that's why you can have mouth, gum, and lip sores for Crohn's disease. And sometimes people were never told this by their medical doctor, and so they don't know why they're getting mouth sores. They might think it's herpes or something else. And it actually can be a symptom of Crohn's disease, so make sure you keep that in mind. Now, one difference also for Crohn's disease is that in the colon, there are healthy tissue that separates damaged tissue. So if you do a colonoscopy, they will find something called skip lesions, where you have damaged tissue separated by healthy tissue separated by damaged tissue. So it skips like that, which is not what happens in ulcerative colitis. Also, for Crohn's disease, you are more likely to have fissures, which are little tears in the colon or in the rectum, or narrowing. So you can have your colon or large intestine can actually start narrowing. Another name for that is stricture, and that will make it harder for food to pass through. That's definitely something that you want to avoid, and if it's already starting on you, you definitely want to monitor it so it doesn't progress, and make sure you take the proper actions for that. So that's Crohn's disease. Let's move on to ulcerative colitis. Now, for ulcerative colitis, it is more localized just in the colon itself. It doesn't really hardly ever go all the way up to the mouth, for example, like Crohn's disease can. However, because you have ulcers in your colon, ulcerative colitis, ulcers in the colon, you do tend to get worse rectal bleeding in ulcerative colitis, unfortunately. And there's no healthy areas between the inflamed spots. So we talked about in Crohn's disease, we have these skip lesions when you get a colonoscopy. If they diagnose you with Crohn's, they should find those skip lesions. If you have continuous inflammation, continuous damage in your large intestine or colon, then that is characteristic of ulcerative colitis and not Crohn's disease. So these, again, it's not a fully extensive list. There are sometimes weird symptoms that pop up that aren't included on this list, but this is by far the most common symptoms. But again, You don't have to have all of these symptoms to have these conditions, especially if your condition is still in a mild stage, or if you are in more of a remission period or a quieter period. You might not be having any symptoms or just very few symptoms. And then maybe at other times you might be experiencing more symptoms or a more diverse array of symptoms. So I hope this was helpful in kind of distinguishing the differences and similarities in the symptoms for Crohn's and ulcerative colitis. Make sure you subscribe to the channel if you haven't already. I share a lot of very useful and research-based tips that can help you if you are suffering from Crohn's and ulcerative colitis. So until I see you next time, take care. Hey, Dr. Sean here again. I just want to jump in at the end of this video to let you know that I created a free mini course for those of you who have inflammatory bowel disease, Crohn's, and ulcerative colitis. It's called IBD Get Your Fats Right, and what it is it's really a comprehensive mini course trying to make it as simple as possible on the importance of choosing certain fats to consume on a daily basis compared to others. Because most people don't understand or underestimate the role that the types of fats that you consume and possibly the quantity of fats that you consume can play a major role in symptom progression and the ability to possibly get into remission if you're suffering with inflammatory bowel disease. This is something that's critically important. It's why I created a free mini course around it. Trust me, it goes way farther than just eat good fats and avoid bad fats. You're really gonna love it. It's really gonna help you understand what you need to do in order to gain freedom potentially from your chronic health condition. So I urge you to just check it out. It's completely free. There is going to be a link in the description below, so just go there and check it out. I hope it serves you, and I'm excited to see you again. Take care.